Let me ask you about people from ethnic minorities. Again, this has been discussed, but we don't really know why. There seem to be a disproportionate number of people from BAME communities who are getting this illness really quite seriously and dying in many cases. Have you been able to have a look at that yourself? Do you have any of your own theories?
Well, the thing is, this is what the coronavirus has done is hold up a mirror to our society to show that there are massive health inequalities. Now, that's something I've been banging on about for about 10 years. But this is another example that actually Black ethnic minority communities have been underfunded for decades upon decades in regards to economic well-being, in regards to medical well-being and physical, and the amount of services that austerity cuts have actually been the effect of what we're seeing now. And suddenly Middle England has woken up to say, oh my gosh, there's more deaths within Black ethnic minority communities. In fact, this has been happening for years. We've been saying it all the time, but this is just holding up a mirror to what's been going on. Now, the thing that grates me so much, Rachel, is the fact that people say, well, it's because they're not practicing self-distancing rules and also they co-inhabit. That is such a simplistic argument. This is a system fault. This is the fact that this has been going on for years and years and years. And what we need to be doing is actually protecting our communities far more. And if at the end of it, what we learn is that we need as a society to be investing in our healthcare, particularly in those that are from ethnic minority communities, because they're the ones that have a lot of face-to-face contact with people. They're the ones that are going to be in the lower economic roles, which, as the government said a couple of months ago, are unskilled workers. And also, they're the people who are coming from migrant communities as well. And again, these are things that have been always ignored. I think this is just an example that we've suddenly come to realise far more acutely, because, like I say, we are in the middle of a pandemic, and it's taken a pandemic to realise that there are massive health inequalities in the UK and across the world.
Thank you very much indeed for talking to us and for your contributions this morning. Really appreciate it. Dr. Nigat Arif.